Well, now that we're opening up, is it now safe to go back to the emergency room? Joining me now is Dr. Barry Rosenthal. See, now that we're not live, I'm going to mess this up. All right. 2. Well, now that we're opening back up, is it now safe to go back to the emergency room? Joining me now is Dr. Barry Rosenthal, the chair of emergency medicine at NYU Winthrop Hospital. Thank you so much for your time. So let me ask you this. Is it safe now to go back to the ER?
Yes, it is absolutely safe to go back to the emergency department. Where we are now, 4 months later, we're in a much different place than we were before. There are many processes in place to assure patients and their visitors that it is safe.
So what are emergency rooms doing to keep people safe at this point?
So, well, for one, just to let people know, the number of patients with COVID in New York metropolitan hospitals has dropped dramatically. So at NYU Winthrop, for instance, right now only 4% of the patients in the hospital have tested positive for COVID, and the vast majority of those patients are in the hospital for non-COVID related illnesses. So people who come to the hospital with appendicitis or gallbladder problems or chest pain or shortness of breath or strokes, they're coming in for those problems, not for COVID, but they may be tested positive for COVID. But we have very few patients who are actually being currently treated for COVID infections right now. So the number has declined dramatically, but we're keeping our guard up. And the process that we have in place right now, number one, every employee who steps into the hospital has a temperature check and fills out a questionnaire, a health questionnaire. Every visitor who enters the hospital has a temperature check and also is queried as to whether they've been exposed to COVID or have any symptoms of COVID. All patients who come to the emergency department are greeted immediately and given a mask. And actually every single employee in the hospital has a mask. So as far as wearing masks, hospitals really are quite a safe place because in the general public, people are not always wearing masks, but in the hospital, absolutely every employee is wearing a mask in every single location in the hospital. And if you come to the emergency department, you're immediately screened to see whether there's any evidence that you might have been exposed to COVID or if you have COVID. And if there's even the slightest suspicion, you're put into an isolation area away from the rest of the patients. And if you are admitted to the hospital, regardless of whether you have COVID symptoms or not, you are tested for COVID. And you do not leave the emergency department until we have the result back. And if you do test positive for COVID, even if you're not being admitted for COVID-related problems, you're going to dedicated floors that are reserved for COVID patients. So the two populations, the COVID population or the potential COVID population and the general population are separated from the moment one enters the hospital.
Okay, Dr. Barry Rosenthal, chair of emergency medicine at NYU. Appreciate